Hello, I'm Dr. Schreitz with Doctors Optimum, and today I'm going to talk about vitamin D. So, what is vitamin D? It's actually really not a vitamin at all. It's a fat-soluble hormone, and it's present in very few foods, but it's added to many others. It's a dietary supplement. It can be in a liquid form, it can be in powder form, and our research has shown that it's actually better in a liquid form. More importantly, it's better in a liquid form that also has an added fat. Now, if you flip the label of your vitamin D, it might be with a vitamin E, which is a liquid fat soluble vitamin, with a mixed D-alpha tocopherol. Could even be in fish oil because that is a fat. But ours comes in what's called MCT, which is a medium chain triglyceride. Essentially a type of fat, and medium chain triglycerides comes in many forms. It could be olive oil, it could be coconut oil, it could be sesame seed oil, it could be any of those particular forms, and that's called a medium chain triglycerides. Those are what's called good fats, like what's in an avocado. Now, some people say, well, I went outside today, so I got plenty of vitamin D, and that is true. The body does trigger a response when the sunlight hits the skin. It should what's called synthesize the Z hormone, and there's a difference between D3 and D2, and it synthesizes and changes it. So keep in mind, vitamin D was first found thought to be a vitamin, but really it's a hormone, and it's calciferol or cholecalciferol, and there's ergocalciferol, which is the D2 form. D2 is typically what you find in the pharmaceutical brands, and that's what is allowed to be a pharmaceutical. D3 is more on the supplemental side. It's deemed to be more biologically active. It has receptor sites on more receptors than the D2 does. And by the way, DQ can be converted. That's why they can give it in the pharmaceutical side and hope that it actually raises the D count. Why take vitamin D? There are a lot of conditions that vitamin D has been shown to help out. And we also do a blood test if there's a question at all to find out, is the vitamin D in your particular body adequate? Do you need to supplement with vitamin D? And then when you supplement with vitamin D, did it raise your values to what is considered normal or not? So why should you even take our vitamin D? Well, number one, it's in a liquid form. If you remember, that liquid form is a little bit more viable than a powder form. Our particular liquid can be taken alone, or you can add it to any liquid. We formulated because we wanted to make sure that it is the right vitamin D and that it has a fat with it called the MCT, the medium chain triglyceride. And we have plenty of studies that show, including many documentations within our own office, that show it's a pretty good supplement just for muscular pain, low back pain, diabetes, autoimmune conditions. It has to be there. Of course, we use the biologically active D3 form. We didn't want to go with D2. And it's not a pill form, so you can take it at any age. You can just drop it or add it to anything. And of course, all of our products at Dr. Optimum are free of sugar, salt, starch, yeast, wheat, gluten, soy, milk, egg, shellfish, and preservatives. Again, I'm Dr. Trice with Dr. Optimum. Be well.